Sikun Li and Guangzheng, please. Be great to hear you, see you, touch base. There. Hi, Sikun.
Hi.
Nice to see you.
Nice to meet you too. Okay, so I'm gonna share my screen.
Yes, I think you can. Let us know if you can, if you're not able to.
Okay.
Yeah, you can now.
Yeah. Okay, great. Okay.
So maybe if we could do the same thing and like play, if you don't mind playing the presentation so that we get like a whole screen, because otherwise it gets so cut. Is that okay?
Okay, I will use the
Slideshow.
Oh, yeah. Okay.
Beautiful. Thank you so much.
Okay. So today I'm going to share with you my experiments. The title is Empirical Intervention Study on the Therapeutic Effect of a Sacred Geometry Healing System on Autistic Children. This presentation I'm gonna have like 15 minutes, and then I will left a few minutes to have a Q&A session. So this presentation contains background research, methods, results, limitation, and a summary. The background. Autism is a widespread development disorder mainly manifested by social communication disorders, language developmental disorders, and behavioral stereotype. According to the CDC report in 2023, about 1 in 36 American 8-year-olds have autism, which is 22% increase from 2 years ago. According to the conservative estimated, 1 in every 68 babies born in China is an autistic children. That's many years ago, the data. So now we don't get any new recently new report in China. So the number of people will be autism has reached like 10 million. However, at present, the scientific community still lacks research on the pathogenesis and treatment of autism. The journal Science ranked the pathogenesis of autism one of the 125 scientific puzzles. At present, there is no effective treatment for the core disorder of autism. However, doctors and researchers are also actively experimenting integrative therapies in addition to traditional treatments. According to statistics, about 30 to 50% of autistic patients will use integrative or alternative therapy, but most of these therapies lack safety and effectiveness evaluation. The purpose of this study is to evaluate the therapeutic effect of sacred geometry healing system, a novel integrative therapy for autistic children. Sacred geometry healing system, SGHS, is used the principle that everything is composed of different geometric structures to help human cells rebuild the original geometric structure and restore its function so as to achieve the effect of physical and mental rehabilitation. How sacred geometry works. Consciousness, energy, and structure are an interacting trinity. Sacred geometry represents the structure of all things. This structure is found in all levels of human body, ranging from the skeletal system, muscular system, and internal organs, to cells, and even molecules and atoms. At the same time, in the chakras and the meridians, etc. The energy system is also full of different sacred geometry structures. When we directly rebuild the dysfunctional structure in the human energy field, the perfect structure will bring about the reorganization of the human cell structure, energy conversion, connection, and healing, and changes in the frequency of the consciousness, so as to realize the recovery and the reconstruction of function at all levels of the body, mind, and spirit. Sikun Li, that's me, is the inventor of the SGHS. I discovered that human body and energy body are full of various sacred geometry structure, and discovered the targeted functions of all these structures. When we place this specific sacred geometry on the corresponding body position of the client through contact or remote visualization, it begins to heal the corresponding physical and mental symptoms very specifically. This set of methods can not only be used to treat the physical and mental dysfunction of ordinary people, but also specifically heal the core symptoms of the children with autism. So our research methods, the subjects were 182 children with autism, and the age from 7.8 to minus or plus 3.6 years. So the procedure is the interventions were performed twice a week, with each interventions lasting about 20 to 30 minutes, and 20 interventions for about 10 weeks. And parents complete the questionnaire twice, pre and post their interventions. The tools, the measurement tools we use is the first one is the CARS, the Children Autism Rating Scale. It is the most commonly used autism measurement scale in the world. Second one is the ABC. It is one of the most commonly used autism scales in Chinese hospitals. And third one is Caregivers Quality of Life Scale, measure the quality of life of patient family. The fourth is Caregivers Anxiety Scale, and the fifth is the Caregivers Depression Scale, and the sixth is the Children's Life Scale, measures children's living conditions such as sleep, diet, and emotion states. And the result, so we can see the change in the scores measured before and after 20 interventions. The CARS, the CARS scores decreased from 33.18 to 29.4 statistical significance. which was lower than the diagnostic criteria for the autism for the scale. And the ABC also draws from decrease from this 63.45 to 52.61 statistic significant, which was also very lower than the diagnostic standard score of autism of the scale. And the quality of life also increased from 20 to 22. So, and the anxiety, this is the anxiety decrease from 32.67 to 12. Yeah, and this is depression level also dropped. And this is child life quality, children's quality of life increase. These are all statistic significant. Okay. Change in scores measured before and after 40 interventions. There are 78 autistic children finished 40 treatments. These improvements were larger than those who complete 20 treatments children. All questionnaire scores improved statistically significant. So we can see the difference. Okay. We are not just using questionnaires to measure autistic children's improvement. We also ask about their parents, how they feel, whether the children changes or not. Here is the parents' report. The pie chart shows the degrees to which parents feel sacred geometry healing system has improved the children's condition. The degree of improvement ranges from 0 to 3. 0 means no improvement at all. 1 means there seems to be some improvement, but not so obvious. 2, there has been significant improvement, but has not been cured. 3 means there is a very significant improvement that can almost be considered cured. So after 20 interventions, 97% of parents report that SGHS system has improved their children's condition. 52% of parents report that their children has been significantly improved. 2% of parents report that their children has been almost cured. After 40 intervention, 99% of parents report that SGHS improved the children's conditions. 60% of parents report the children has been significantly improved. 5% of parents report in their children has been almost cured. The parents report for improvement for 20 interventions versus 40 interventions. This chart indicates the children conditions change with specific dimensions according to the parents' report. So we can see the therapeutic effort of the 40 interventions are better than 20 interventions in all aspects. Okay. The